Hey everyone, welcome to my office. I'm Dr. Steph, and today I want to do something a little different. I want to offer some guided meditation for dealing with noisy pain. So first I'm going to talk a little bit about the different kinds of pain and then how we're going to work with it. So I've been thinking about kind of three types of pain. The first is productive discomfort, and this is what people often feel during a massage. They're on my table working on their shoulders and they say, oh, that hurts so good, right? You know that you're a little uncomfortable, but when I stop rubbing too much or, ease up, it goes away pretty quickly. And so that's the kind of pain that we're happy to have. Sometimes that's pain that you also feel during a workout, when you know you're going to be sore tomorrow, but in a good way. So we're happy to be friends with productive discomfort. We know that, okay, this doesn't feel awesome, but it's getting me to where I want to be. I'm getting stronger, I'm getting softer, I'm stretching gently enough that this is going to help make the kind of change I want to make in my body. So we're friends with that kind of pain. The second kind of pain is damaging pain. This is information from your body to your brain saying, this isn't helpful. We have to stop. We are hurting ourselves. We are injuring ourselves. This is causing damage. And that's not the kind of pain we want to push through. And sometimes it's hard to tell the difference between those two kinds of pain. It can feel hard to tell the difference. And the closer a relationship we have with our bodies, the more we can start to learn the difference between how those two things feel and how those two things sort of sound coming up to the brain, the information that we're getting. But this is the hand on the stove pain. This is the walking on a sprained ankle pain, right? Sometimes this is the low back pain that you come in with of it just keeps getting worse. It's not getting any better, right? And so it's really helpful that our body has a way to say, uh-oh, right? We're in trouble. This is causing damage. We need to stop. And so that's the kind of pain we really want to listen to as much as possible and stop. So that's the second kind of pain, productive discomfort, and then damaging pain. And that one we really need to listen to. The third kind of pain I am calling noisy pain. And this sometimes is chronic pain, but noisy pain is just pain that is kind of in the habit of complaining. So it's not causing any damage. It's not making things worse necessarily. It's not that acute pain that tells us we really need to stop. It tells us we might need to go slow or, be gentle, pay attention. But I like to think of noisy pain like a toddler having a fit about their sandwich being cut into squares instead of rectangles or something like that. So noisy pain is just pain that comes into our brain from a body part that is used to complaining, that likes to complain. And as the parent of that toddler, this isn't an emergency. You are safe. I wouldn't put you in a dangerous situation. I can tell you're frustrated, and so I'll sort of sit here with you, but this isn't a big problem. It's a big feeling, but it's not a big problem. So those are kind of the three types of pain. And the first two are easy enough to recognize and work with, right? Productive discomfort, we say like, this is getting me to where I want to be. Damaging pain, we say, I hear you and I'll do everything I can to take care of it. Noisy pain is so tough because it just feels like it's taking over everything. So that's why I want to offer some resources. While I was recovering from hip surgery, I had some noisy pain. And I thought it was damaging pain. And once I was able to talk to my care team, my providers, my physical therapists, my surgeon, I realized this is just kind of noisy pain. And the way the pain works in our brain, the more we sort of listen closely, the more brain real estate we give to that pain, the more it will take. And so then it feels like this is happening all the time. And it can be very worrisome if we think that noisy pain is damaging pain, that every minute I'm doing something that's hurting my body. And talk to your providers, talk to your care team, make sure that what you think is noisy pain isn't damaging pain. Make sure that you're safe and taking care of yourself. But if you've still got that persistent noisy pain and you know that you're safe and okay, that's where this comes in. So I'm going to offer a couple different videos that have different resources in them. And today we're going to do a meditation that is really about, or using a couple different metaphors. And so today's meditation is going to be about shrinking the pain. So close your eyes, get comfortable. I'm going to close my eyes. I'm just going to relax. You don't have to do anything specific with your body. Just be soft, be easy, and sort of start by letting that pain speak to you. Sort of finding it, really seeing the body part, using your mind's eye, seeing the body part that feels uncomfortable. Maybe you need to make some adjustments with your body to be more comfortable while you do this. And sometimes when we're in this noisy pain, that body part feels like it's taking up all the space in our brain. It's the loudest voice we can hear. It drowns out everything else. And so sometimes it's like we have that body part under a magnifying glass. Like that is so big. It takes up so much of our attention. So maybe that's how this feels for you. And I want you to start to do instead is have a really clear picture in your mind of where this is in your body, what body part this is, and really slowly start to shrink that body part. Like we are taking the magnifying glass away from our eye, pulling it back, zooming out, and making that body part smaller and smaller so that it's almost like you were looking backwards through binoculars or backwards through a telescope. I also like to picture that part of my body being like the size of a doll. When I was having the hip pain, I imagined like a little Barbie doll and like a hip just that tiny. Even on my own body, the rest of my body's the same size. But just that one part of my body gets really teeny. So turn those binoculars around instead of making it really big and go slowly, zoom out and see if you can flip those binoculars around, flip the telescope around and make that part of the body super duper tiny, super duper tiny. Maybe it's your wrist or your shoulders or your low back or your foot, whatever it is. It's so small, like toy action figure small. And notice how that changes the voice of the pain, right? That teensy little body part isn't going to be able to make so much noise. It's not going to take up so much of the field of attention and vision. It's just really small. So shrink that body part down as much as you can. And notice how the sensation changes. If you feel it kind of blowing up again, just practice zooming out, pulling it away from your face, almost like a book that you have right up against your eyes. It's too big, too close. And you can just pull it further and further away from you so that it just gets smaller and smaller. And you can look at, instead of just focusing now, we have that one teeny tiny part of our body that's just toy sized. And now look at the rest of your body, just again, with your mind's eye, sort of full size. Oh, I have other parts of my body that feel okay. Maybe they even feel great. Maybe there's other good stuff happening. But full size body, full size legs and arms and torso and heart and face, hands. And then teensy tiny noisy part, right? We're just shrinking that voice down. We're not saying I don't believe you. We're not saying you don't. We're just saying you are just this big now. So really shrinking it. And it's not that complicated, but we're spending a lot of time practicing zooming out, making it so small, shrinking that voice. Shrinking that part of the body, really picture in your brain. And if it's helpful, look at, a little toy doll or a little something. Like really picture something super, super, super teensy. And then look at the rest of your body full size and say, look how much of my body there is. That feels good, that feels okay, that feels safe, that feels normal. And then I have just this one teensy, teensy little bit that's noisy. The image that I use the most, or helps me the most, besides my little teeny Barbie hip, is just imagining turning that telescope around. Sometimes when I notice myself pulling out that pocket telescope and really making that noisy pain bigger, I have to say, oh, I need to flip that around and make it super duper small. So I'm throwing out a couple different images here, ways to do this, but this technique is all about really, really visualizing, really strongly visualizing, making that body part smaller. The shrinking, 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 and then the final product of that really tiny body part, normal rest of the body, teensy, 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 little teensy, noisy part. And notice how you feel. Keep coming back to this as much as you need to. That was like 5-ish minutes of that, and you can replay that and watch that again if you need to. But hopefully that's a strategy that you can use. And I'll be making some other videos of other metaphors that we can use to work with that noisy pain. Again, please check in with your providers, doctors, chiropractors, physical therapists to make sure that the pain that you're experiencing isn't causing further damage, that you are in fact safe, that you're taking care of what you need to take care of with this pain. And when you know that you are safe and that you are okay, and this is, I don't want to say just noisy pain because it is bothersome, but when you've got noisy pain and not damaging pain, you can use this technique of shrinking, using your mind's eye, really visualize shrinking that body part and ending up with a really teensy body part, normal sized body, right? All right, thanks for joining me. If you have any questions, please reach out to me through my website, drstephvos.com, drstephvos.com. And thanks for taking good care of yourselves. Stay tuned for the next one.